Okay, great. So welcome everybody. I'm Dr. Sara Siddiqui, and I'm a pediatrician in Huntington at the NYU Langone Huntington Medical Group. And I love coming to do Facebook Live events and just talking about general issues. And I was invited by the Elwood Public Library. So thank you so much for doing this. So this month's topic, or a topic that was requested, was to talk about learning disorders in children. And what I wanted to give you was the perspective from a pediatrician. So, and what we do when we're thinking about something like this, or when we see a child that, who may be there may be a concern, and what goes through our mind when we see kids. So let's just start. And please feel free to ask questions, type them in. If you're going to be watching this later on, you can always send questions in to the library, and I'm always happy to respond any way that I can. So I like to be available to our library that I love. All right, so we're gonna go ahead. This is, excuse me, this is like, we're kind of doing this a different way. I wanted to do slides this time. So please excuse me if, if it's not exactly how, I'm not used to showing slides through Zoom on Facebook. So I thought we'd try it this way though. And I hope you enjoy. So welcome. This is just a preview slide about myself. I'm a pediatrician in Huntington at the NYU Langone Medical Group. I've been there for a number of years, and I love practicing right in my local community where I live. And I just wanted to just go over if I don't have any disclosures to make. Of course, you always want to consult with your own physician or pediatrician for any specific issues with your child. I'm happy to answer any general questions, but for any specific medical advice, you really do want to follow your own physician and pediatrician who knows you the best. And any advice that I give does not replace that of your regular medical provider. And of course, I'm not speaking to any other entity, or I'm not representing anybody right now. I'm just talking from myself, a pediatrician in Huntington from the NYU Langone Medical Group. So just to kind of give you an idea, what we generally tend to look at every visit, when starting from the newborn age, believe it or not, right in the newborn time. And I always tell parents, even at that first visit when they come in with their 3-day-old, each child is so different, has so many different ways to express themselves, and they already start right from birth. And what we call developmental milestones can begin right at in the newborn period. So we look for specific things in a range of ages. So we start very early. We look at even when we're just examining your newborn for the first time, we're looking for if they have eye contact, if they're moving their extremities properly, if they have good muscle tone. We're of course listening to their heart and lungs, and looking in their mouth and their ears, and kind of just overall an inspection is done at that first newborn baby visit, while answering all your questions about feeding and peeing and pooping and lots of things going on right in that beginning early stage. But we are looking at gross motor and fine motor skills, which start very, very early. So they start right at birth. So that's where we kind of start looking at milestones. And milestones, I want to just explain, is they're in a range of time periods. So like certain milestones, for example, eye contact. So that can start pretty soon after birth, but we give it until age at least 2 months. So some babies might not be making eye contact right away, but then we really expect it at a certain time. And if we don't see it at that certain time, it's called a red flag in pediatrics. So we really look for these cornerstone milestones. And if we don't see them, we do get a little bit more concerned. if we don't see them within that range. So these are very important developmental kind of data that we look at, and we are really looking for them at every single pediatric visit. Depending on the age of your child, there's specific things that we kind of look for, and of course every child has a range. So there's always, many parents ask me, well, his older sibling started doing this at this age, but he's not doing it yet. So as long as it's within the range, it's completely normal. Some kids do things very early in the milestone range, for example, walking. So walking could be any time between 9 to 10 months at the earliest. Sometimes, there could be babies out there that are doing it a little bit earlier, until about 15 or 16 months at the latest. So when I see a 1-year-old, most average is at the age of 1, but there are definitely many children that may walk earlier and many babies that may walk later. So whenever I see a 1-year-old and they haven't started walking yet, or they're kind of not there yet, I always try to reassure the parents that it can sometimes take a little bit longer, and different babies develop milestones at different times. So this is very important, right? And then if they were to kind of go beyond that time, where it's beyond the 15 or 16 months when we don't see it, a child walking in the appropriate time, then we definitely look further and we start investigating for other reasons why there might be some delays. So that's when we start looking for developmental delays. And that's kind of the earliest time that you kind of think about developmental delays, and that's in the umbrella of learning disorders. So it's kind of in that realm. So that's why I'm kind of giving like a little bit of preface on that. So like one of the previous slides, actually, I can go back to it. I think I kind of, so the developmental milestones, as you can see in this slide, there's some broad categories that we look at. So early language, gross motor, and fine motor. And at different ages, different children at different ages achieve certain milestones. So one of the most important milestones that we kind of start looking for any type of delays are in language. And we do expect some cooing or some kind of sound that babies make as early as 2 to 3 months. They can start making little sounds when you are talking to them. So I always advise parents of young babies to start talking to their infants as soon as you can, and make it conversational, have pauses in your conversation so that they have an ability to talk back. Kind of. So they do make sounds when they hear a pause in your voice. So we do have some milestones that we definitely get concerned about if they're not achieving. So for speech, if they are not having any type of babbling or any type of sound production like cooing or even any type of voicing sounds by about 6 months, we really do get concerned about that. So that is very rare, but we would get concerned, and that would mean that you may get a referral to something called early intervention. So there's a number of things that we definitely have, like I said, the red flags that we kind of really look for. So if really no sound or no babbling, no cooing between 5 or 6 months, that is something that we would want to investigate further. Of course, there's some gross motor and fine motor skills that they start having. There are some reflexes that we look for in that early 6-month period. And if they are there, or if there are some reflexes that need to go away by a certain period of time. There's something called a Moreau reflex that we do. It's kind of like a startling reflex that babies have. And if they continue to have it beyond the 4 to 6 month mark, that is also a concern for us. So usually there are some milestones that have to kind of disappear by a certain time. So we are also checking for that. And then we get concerned about neurologic issues. So these are all things that we kind of look for. So back to my slide regarding speech milestones. I do look for early, like speech patterns or a few words that they start saying. So by 12 months, I usually want to hear from the parent that, or from the child themselves, that they're saying a few words. So usually they're just not, they're more sounds. So even not necessarily words, but mama and dada, mama, mom, those kind of repetitive sounds usually start between as early as 9 or 10 months, but we really want to start seeing them between 12 and 15 months. And by 15 months, they should be saying 3 to 5 words. And they could be half words, or they could be kind of not even complete words, but like ba for bottle counts as a word, mom again counts as a word, dada, up sometimes. So these are words that we want to know that your child is saying. And again, if we don't see that, then we do get concerned, and we may refer you to something called early intervention. So early intervention is a great program that all pediatricians really, definitely myself, refer a lot to. So early intervention is a program that is run by each individual county. So we have through Suffolk County Department of Health, and it's prior to the age of 3. And if we find that there's any type of delay in speech or in any gross motor or fine motor movements, for example, if I feel that we're not walking at an appropriate time, or even rolling. So rolling should occur between 4 to 6 months. If in some babies I don't see that happening, or they should have like good neck control by about 3 or 4 months. So if I don't see that happening, I do recommend an evaluation through early intervention. And they can come in and evaluate and see if maybe we need some physical therapy, or if we need some extra attention to these kind of milestones, and see if we can help to achieve them. And another thing that happens if we do see some gross motor or fine motor or even speech delays, you may be referred to a pediatric neurologist to do some further testing and workup. So what I find is early intervention can, if evaluated and the child does need some services, for example, physical therapy or occupational therapy or speech therapy, it can help narrow the gap. And the earlier you do it, so I can't stress this enough, because sometimes parents, I guess, aren't sure of why we're recommending to just at least be evaluated by early intervention. So I find that if we detect a slight delay, it's easier to treat when there's only a slight delay versus waiting for there to be a larger gap, and then it's harder to narrow the gap. But it can still be done, but sometimes it is easier to, if you identify something early enough, and being aggressive with early intervention, you can help. If early intervention, which is like through Suffolk County Department of Health, deems that everything is within the normal range, so they also kind of evaluate a little bit more thoroughly. They detect whether you're on 1 or 2 standard deviations away from the normal time that we're supposed to achieve these milestones. If they deem that everything is within the range, and they may not want to start services or put you into services through the Suffolk County Department of Health, there are ways to have it done if we feel, if your pediatrician feels, or even if you've been to the pediatric neurologist at this point, feel that maybe an outside or private therapy through your insurance plan could sometimes be something that could be started at that time. But I'm a big fan of being evaluated by early intervention, if even I'm thinking that there may be a slight issue. So beyond the age of 3, once you're at 2.5 or close to 3, early intervention kind of goes to the school district. So after the age of 3, if we pick up still some issues with speech, or sometimes gross motor skills, balancing, occupational therapy, so fine motor skills, which are treated by occupational therapy, but fine motor skills such as like building or putting blocks together, puzzle pieces, writing, cutting. Those are all things that are kind of done with your with your hands, that require fine motor and sometimes spatial relations. So all those things are evaluated by the school district. So even though they're not going to school or not in the school district in terms of pre-K or kindergarten, but starting at age 3, your school district will evaluate and to see if you meet criteria for some intervention at that time. So that is also something that's a really great thing, and that is required. And then just to kind of go into more like learning issues. So once, and then the other thing that actually the school district, but also at your pediatrician's office, we do annual hearing and vision screens. And these are all very important also for picking up any type of reason to have other delays taking place. So obviously, if there's a hearing issue or a visual issue, these need to be corrected so that the child can have an optimal learning environment. And of course, these any hearing issues or vision issues, the earlier the better to be picked up. So actually in our office, we do a vision screening for lazy eye starting at 6 months. We have like a screen that the baby looks into, and we can detect whether there is some difference between the vision. So it's not a vision test in terms of you're just getting like a 20/20 or 20/40 result. You're getting information regarding the vision between both eyes and whether that's equal or not. Because lazy eye or amblyopia is another definite diagnosis that the earlier you recognize it. So again, early intervention is a key component here. The earlier you recognize it, the easier it is to treat it, because lazy eye is something that if not detected until the vision is already different in both eyes, when the child is a little bit older, it's a little bit harder to correct, because what you have to do is obstruct the vision of the good eye so that the weaker eye can become stronger. But if you detect it earlier, the treatment is much, much easier and for a shorter amount of time. So I think I kind of digressed a little bit, but I thought that was an important point. So hearing and vision is checked all the time or annually at your pediatrician's office as well. So just to kind of go into more specific like learning type disorders that could occur a little bit later, like when the children start school. So sometimes we can assess school readiness, and sometimes there are certain things that the child may or may not be able to do, starting even kindergarten or first grade. And so they can range from different processing type issues in reading, math, written expression, and even nonverbal, like social kind of cues. So there are a multitude of learning issues that can present in each of those categories, and they kind of get looked at differently. So there are school evaluations that can take place, but there are also some medical evaluations that can take place too. So we also can refer to a neurologist for that too, who can refer for either psychoeducational testing or neuropsychological testing. So there's many different types of testing that can be done. But the most important thing here is to identify early, if possible. And that way you can get the intervention that you need. You can get the accommodations that you may need for your child to learn in the best way possible. There are, so attention issues sometimes are very, very common, but definitely can coincide with other issues taking place, other learning issues taking place. So let's say you can have like a dyslexia type picture or a dyscalculia type of picture, which is like where children may have trouble with mathematical concepts, and that can also accompany attention issues. So attention issues is a very, very broad category, and we're still learning so much about it now, even because as we screen time can affect how our brains work. So definitely sometimes some attention issues can be a result of perhaps some increase in screen time, increase in attention issues. Disruptive sleep also can cause some attention issues. So it is a very, very broad category, but it is something that we do think about, and we do want to know. So your pediatrician does want to know if your school or if your child is having trouble, and your teacher is recommending that you speak to your pediatrician. We do want to know, because we can help you kind of dissect out what's going on. Like right here on the screen, learning disorders can accompany attention disorders and developmental delays. So that's really, really important. They can all kind of intersect with each other, and sometimes it's difficult to kind of dissect out what component is what. So that's where it's really important to do kind of very individualized testing. Each child is different, so there's no general kind of recipe that I recommend. Each child is definitely very individualized, needs very individualized attention when talking about learning and attention issues. Comprehensive learning plans may be needed. So you may need occupational therapy, physical therapy, along with some cognitive behavioral therapy or some social skills development. So all these kind of coincide. We know that our brain is a very, very complex structure. There's a lot of things that are going on, especially in the elementary age, so K through 5 age. There's a lot of different changes going on, a lot of different neurons that are activating, and sometimes it can take time to figure out exactly what, if there is a delay, exactly where that component is that may need help. So you do want to talk to your pediatrician, and sometimes genetic testing, which I didn't really touch upon before, but genetic testing is also something that is done very commonly now, a lot easier to do in terms of testing. It is sometimes difficult to get an appointment with a geneticist, but I do find that this is a helpful thing to do at least one time to make sure there's no obvious genetic issues that could be the cause of some of the delays. Occupational therapy, I just want to touch on that a little bit more. So occupational therapy, I think, is one of the most important interventions that we can do. Unfortunately, it is very difficult to come by sometimes in the schools, but it is something that you can do outside of school. And I really think that this is also something that if we start early, it can really help them. So manipulatives in the younger age groups is definitely so important. Things like blocks and puzzles and those kind of shape, those boxes that have different shapes, and your child puts the different shape in the hole that has that shape in it. Those are so important because that kind of helps them to develop the spatial concepts, and through practice and repetitive and performing repetitively. So this is from, actually this statement, the occupational therapy statement, is from our child studies program that's in Lake Success through NYU. They have an office in Manhattan and also Lake Success, and they offer things like occupational and physical therapy. So these are just some instances there. So sensory processing disorder, I didn't write too much about that, but this is also a big interest of mine. And this can also accompany not only attention issues, but it can provide a lot of information about children, especially going into maybe kindergarten or pre-K, that are having what seems to be like emotional issues or behavioral issues, but can be kind of looked at as a sensory issue. So we all have certain things that we kind of like texturally, or things like clothes that we wear, or foods that we like or don't like, and it kind of comes down to your sensory, like how you feel about it, how you feel about the texture, and how you feel about the sensation. So this can happen quite at a young age, where certain children have an excessive amount of sensitivity, or they're actually aware of their surroundings much more than average, maybe. And it could be a function of their stronger neurologic system. So basically they're getting information from all areas, and they have a hard time dissecting out which area they're going to take the information from. So it's kind of like an information overload. Sometimes sound can do this. Sometimes certain touch textures, or certain kids that don't like certain tags. So I know some companies stop putting tags in their clothing because the tags would disturb the kids. Sometimes certain kids don't like the stitching on the socks. So right by the feet area, there's like certain stitching right there. So certain children just don't like that feeling that they get. And that could be a little bit of a sensory issue. So some kids do very well once we kind of identify what specific issues bother them. When they're not, sometimes they could be nonverbal, or they're under the age of 2 or 3, and they can't identify specifically what's bothering them. And that's when you have certain behavioral issues that stem from that. Basically, they're just upset about maybe the piece of clothing that they're wearing, or perhaps they don't like how that piece of food feels on their mouth, and they get upset, but they can't identify, or they can't tell you or communicate why they're getting upset. So sensory processing disorder is something that is completely can be helped. And if it's identified early, it's one of those things that also, if identified early, if we can kind of get an idea that may be what's happening, we can provide help on how to manage it and how to treat it. Not so much treat it, but how the child can come to terms with it. So it's one of those things that it's treated in terms of it doesn't really fully go away, but the child can identify what the things are that could be bothering them, and then either avoid those certain things, or perhaps change the way that input is being given to them. So I just wanted to talk about that too, because I feel like that's an important component in certain learning issues. Cognitive behavioral therapy. So this is something that is in the newer types of therapy. I'm talking in the last like maybe 20 years. It is something that is really good for all different types of children. It definitely can help children that are having maybe attention issues, or maybe they're having issues with social skills, or emotional issues regarding school. But it is something that it can be targeted to each child, and can help in even certain anxieties that certain children may feel. And I think it's a great, you have to find the right therapist and the right fit for your child, or even for the parent and child, and the parent can learn some of the therapies that they're recommending. But it is something that can be very, very beneficial, and help the child improve how they feel, and help the child with any learning issues also, because as you know, the learning issues can go into more of behavioral issues also, when you have disturbances in like things like self-confidence and how to communicate different things. So this is also a very important part of treatment and management. And then social skills therapy also is something that I like to recommend in certain, if we're having some behavioral issues or even learning issues, because this can ultimately help in the communication. So you can start, this is something that can be started even in a young child or someone that's a little bit older that's having difficulty with certain communication or certain skills within or outside the classroom, but definitely it can be beneficial to all children. And then I just wanted to touch upon autism spectrum disorders. This is something that can be found early, like I said, when we were talking about the developmental milestones. Sometimes we can, I mean, there's such a wide range of delays that I really don't even like to use the term autism spectrum until there's like a full evaluation done, because there's such a huge range, and there's such, I mean, all the treatments that we just talked about and all the interventions that we talked about can sometimes be done, and you don't really need like a specific diagnosis. You can have a broad diagnosis where you have like a learning issue or a developmental slight delay, and you could get some of the therapies and interventions for all of those things for your child. But again, early intervention is the most important thing to help improve some of the social aspects of some of these developmental and learning issues. So it's definitely important to really ask your pediatrician at every visit, you know, what milestones should I be looking for? What's the next step in development? What things can I do to help my child? You know, and if there is any concern that you're having regarding any issue, it is really important to communicate that with your pediatrician. So you know that when you go into your visits, you're seeing us just for a few minutes. I mean, usually 10 to 15 minutes, and we're starting to talk about all the other things that we need to talk about. So you really do want to have a list of things that you want to touch upon with your pediatrician if you're concerned about something, because we really rely on the information that you tell us regarding your child. Of course, we're observing them and we're examining them, but that's like one point in time. I always tell all my families that I'm only looking at them in one point in time. So it is important to kind of discuss that. And of course, with attention deficit disorders too, we do try to evaluate over a period of time. So sometimes it's not something that can be diagnosed quickly like ADHD or ADD. It is something that we need a wide range of data and information for. And that's another important part of the evaluation. And it's an ongoing evaluation. Oh, okay, yes. So the testing, I just wanted to touch upon the different types of testing that could be offered to your child. So psychoeducational testing is the IQ test, although they're not doing so much of the IQ testing to I mean, it's more to kind of see what the range is, or maybe kind of have like some objective data. But academic, social emotional skills, speech and language, these are all things that are tested to see if any of those things are causing issues with learning in the school environment. And then neuropsych testing is also a very important component, especially with attention type issues and memory. So short-term and long-term memory. Some children do have trouble retaining information after just learning it one time. So there are ways to help in that respect. But each child is so different, and each child has their own way of learning. Some children learn by more audio, or some kids are more audio learners. Some kids are more visual learners. So it's really important to try to identify the best way. So it doesn't mean that there's a learning disability per se, but sometimes it can be a matter of kind of solving that piece of the puzzle about what the best way is that that child learns. So there's so many different aspects that you want to touch upon. And I think that was kind of what all the points that I wanted to touch upon. I'm not sure if we have any questions. Eric, if you're still there, because I can't see the Facebook. Let me see if I can.
Yes, I am.
Oh, okay. Hi. So yeah, we touched on a bit. I'm not sure if there are any questions or anybody that's out there. If I stop sharing, Eric, then I'll be able to see the Facebook, or will it kind of be more the
Try stopping sharing.
stop sharing? Okay. Oh, okay. Great. So. Oh, okay. Hi. Excellent. And then, yeah, is there any questions on Facebook Live? Because I don't really see that part of it.
Not yet at this time, but you probably hear yourself because I have like a double of you like going here. So.
Oh, is that what's going on? Okay,
Yeah.
so I just hear me. Okay. I mean, I'm sure that if people watch this later, or if they have any questions later, they can always type it in, and I'd be happy to answer any questions specific.
There's nothing yet.
Of course, if there's any specific questions that I think that I may not be able to answer, or something that maybe diverted to more your pediatrician or your medical care provider, it would always be better. But yeah, that's all I had. That's all I had. That's all she wrote.
Okay, thank you, Dr. Siddiqui.
Okay. All right, thank you.